All right, I've got my little assistant here, Franny, just to help us with demonstrating how we use a couple of muzzles. So these are just nice, soft, long pieces of thick fabric, and this is a really nice way to use a muzzle because it can stay on for a while. If it's not too tight, it's more comfortable and flexible, and it's easier to transport a pet with this if we need to take them to the vet. So you're just going to make a nice loop with your fabric about halfway through. I've got a pretty small loop for her because she's a little dog, and we're going to put that right over her nose and bring it up behind her ears and tie it at a nice little bow right there. That way, always do the bow so it's quick release, so that if something happens and you need to get them out of it right away, all we have to do is pull and she's right out of it. Easy peasy. The other type you can do, these are our leads that we have every day in the salon. And you can just take your loop, if it's already on a dog and it's over their neck like this, and turn you this way, little Fran. Then you can just take your handheld part, loop it over the nose once or twice, and you can even put it back through the neck right there. And then you have a lead that the dog's also muzzled in, and that's easy to pull right off as well really quickly. All right, I've got a new assistant here, Maisie, and we're going to do a snout-to-tail assessment on her. That's literally like it sounds. We're going to run our hands over all parts of this dog's body from her nose to her tail. And first I'm going to look at her eyes and nose, look and see if there's any discharge, discoloration, that her eyes are equal with her pupils dilated. And also her mouth, might feel along the muzzle any abnormalities, deformities, anything going on there. I'm also going to be able to see if her teeth are really bad at this point. If we're doing this in a non-emergency situation, it's a good way to see if they need to go to the dentist and let the pet parent know. And then of course I'm going to look inside the ears. Everything should be pink, clean, and healthy with no bad smell or discharge from the ears. And also feel along the skull and neck if there's any deformities or anything that stands out as odd, and that they have full range of motion in that neck as well. And then we'll move down into the shoulders and front legs and chest area. I like to run my hand down the entire leg, also feeling for any deformities, as well as range of motion for this pet. So at this point, if anything's hurt or broken, they'll let us know that it hurts, and they won't have range of motion. And even for pulled tendons and ligaments, they might not have good full range of motion on you, and so we're going to note that. Also going to check toenails, that they're not cracked or torn, and paw pads. Kind of like to run my fingers through toes and paw pads, make sure there's no foreign objects and some stickers in there. And then we'll move on to our abdomen. Just gently with the pads of your fingers or the flats of your hand, just going to gently put even pressure as we go down, feeling for any lumps, bumps, if the dog reacts in pain. And while we're there, we can also feel the rib cage area, see if anything's sticking out or abnormal in the rib cage area, or again, if they respond in pain. I always like to kind of run my two fingers down either side of their spine, putting a gentle pressure there, just to make sure they don't react in pain anywhere on that. And that'll lead me right into the tail, and making sure that they don't have any, a broken tail or injuries to the tail, and that there's full range of motion there. And I do kind of like to sweep my hands over genitals. There shouldn't be any swelling, redness, discharge that's colored or anything like that. And then we'll do the same thing on the back leg, feeling down to the paw pads and toenails and checking that the dog has full range of motion on that. All right, so we're into the portion where we're going to learn how to check pets' vital signs. And the first thing that we're going to talk about is checking for a pulse. So anywhere that a major artery comes closer to the skin is a good place to check the pulse, but often the easiest place is the femoral artery, which runs right here at the back leg where the leg meets the groin area. So it's in this crease right in here. You can, if you have a bigger dog, run your hand from this direction. They're generally a little bit more comfortable with that than coming from the back near their genitals. She's not super comfortable with laying down for me, which is fair. You can do a pulse check while the dog is standing as well. It's a little bit harder when they're sitting, but since she's kind of letting me have her lay down, so it's a little easier to see for you. Just gonna run my fingers down her tummy, and I'm gonna find that crease right where her back leg meets the groin area. And with just the pads of my finger or fingers, I'm gonna hold it right there and wait to feel the pulse in that area. I like to count for 6 seconds and then add 0 to that, so I have a full minute or 60-second count. So let's go ahead and take her pulse. 4, 6. So that's 6 in 6 seconds. I'm going to add a 0 to that, and we're at 60 for her pulse today. Good job. All right, so it's important to know that a normal pulse rate for most dogs is between 60 and 140 beats per minute. So as demonstrated, Franny's was at 60. That's normal. And then small and toy breeds can be a little higher, so 90 to 140. And so anything over 140 might be a little bit concerning. And then cats range from 140 to 250. So double the pulse rate of dogs. So don't panic if the cat's pulse is that high. They might just be a little bit stressed out. But it's kind of normal for them to be in that range. Okay, for checking breathing and breaths per minute, same thing if you have a dog laying down or standing up or sitting. You're going to place your hand on the side of the chest. So, kind of shit has a little, but I don't. So you're just going to take your hand and slide it down behind their back leg, right, or their front leg, onto their rib and chest area right here, just behind the front leg, and just wait until you see that rise and fall of the chest and feel that, and then you're going to count that. Same kind of thing, you're going to count it for 30 seconds and then double that number. The breaths, also pay attention to the character of the breaths. They should be smooth, rhythmic, and easy. They shouldn't be labored. There shouldn't be a loud wheezing sound or what we call stridor when they're breathing in. So it's going to sound like kind of thing. That might be an obstructed airway. So you're going to look for that breathing to be relaxed. Even if they're panting, the air should be flowing smoothly in and out of their chest when you're feeling it on the chest. And then a normal breath rate for a dog is between 10 and 30 breaths per minute. And cats are going to be between 20 and 30. So again, a little bit faster for cats. But we shouldn't be over 30 unless the dog is beginning to get into a stressful situation. The next thing that we can check for vital signs is our gums and gum color. It's a pretty open mucous membrane area, so it really shows the state of that pet's health very easily for us to see. The first thing we should look for is that the gums are a little bit moist to the touch, and that we're going to do capillary refill next. I'm sorry. So we'll go through a few of the colors. The gum should be pink, like just a gentle bubble gum pink is normal for dogs. If they're yellow, we could be looking at something like a jaundice or liver disease issue, or even an immune or anemia issue. If they're bleeding or inflamed, this could be gingivitis or a dental issue. And then pale or white. If the gums are pale or white, or even sometimes going into blue, this is signifies a lack of blood flow. So they could be in shock, have anemia, or just have low blood pressure. Bright and cherry red gums is not good either. This could be a sign of very high blood pressure, of heat stroke, or even in some cases of poisoning or foreign chemical in the body. So we want that bubblegum pink, not bright red or cherry pink. Blue, purple, or gray. This is called cyanosis, and it signals very, very poor circulation, as if the heart is not able to do its job and properly circulate the blood throughout the body at all, or a blood volume issue. So if this pet has lost too much blood and they don't have enough volume for the heart to do its job and pump that blood around, then you're going to see very blue, purple, or gray. And it also could be a sign of hypothermia or respiratory disease or heart disease. And then spotted or mottled gums. This is normal in some breeds that have, you know, a mottled undertone to the skin. Might see this in chows. You know, we've seen various mixed breeds that have kind of a mottled. So just pay attention to the parts where you can see the color that are not black and check there for your coloring on that. And then while you're there checking the gums, another good thing to check for our vital signs list is capillary refill. So the small veins in that area are called capillary veins because they're smaller than the regular veins or arteries going the other direction. And so it's easy to see on the gums when you press gently in on the gums and hold for a second. What you're doing is stopping the blood flow from the area underneath your finger, and then you're going to release and watch how quickly those capillary veins refill and the color comes back into the area that you've pressed. So you want to see it fill back in within 2 seconds or less. It should immediately send that blood flow right back into that area. If it doesn't, we're having a blood flow issue.